Welcome to our channel. Today, we're diving into some crucial facts about tuberculosis, a disease that affects millions worldwide. You know me? I'm all about giving you the information you need to stay healthy, and understanding TB is a big part of that. We're going to break down the basics from what causes TB to how it's treated and everything in between. Let's get started. So, what exactly causes tuberculosis? Well, it all starts with a tiny culprit called Mycobacterium tuberculosis. This bacterium is the mastermind behind all the trouble. It's a tough little bugger that can really do some damage if it gets a foothold. Tuberculosis is primarily spread through the air, kind of like how the common cold spreads. When someone with active TB coughs, sneezes, or even talks, they release tiny droplets into the air. These droplets can contain the Mycobacterium tuberculosis bacteria. If you breathe in these droplets, you could become infected. One of the most common ways to test for TB is the Mantoux test, also known as the tuberculin skin test or PPD test. A small amount of fluid is injected just under the skin of your arm. Don't worry, it's not a big needle or anything. After a couple of days, a healthcare professional will check your arm for a reaction. While TB can affect other parts of the body, it most commonly attacks the lungs. Remember that Mycobacterium tuberculosis we talked about earlier? Well, when it gets into your lungs, it can cause inflammation and damage. We have vaccines for so many diseases, and luckily, we also have one for TB. It's called the BCG vaccine, which stands for Bacillus calmette-guerin. It's not 100% effective at preventing TB, but it can significantly reduce the risk of developing severe forms of the disease. Now here's where things get a little tricky. You can actually have TB bacteria in your body without being sick. This is called latent TB. The bacteria are basically chilling out, dormant, not causing any symptoms. However, latent TB can reactivate and become active TB, especially if your immune system is weakened. When it comes to treating TB, there are a lot of misconceptions floating around. One common myth is that paracetamol, also known as acetaminophen, can cure TB. Let me be crystal clear. Paracetamol is not a treatment for TB. Treating TB takes time, typically around 6 to 9 months. It's not a quick fix, but it's crucial to stick with the treatment plan your doctor prescribes. Remember, consistency is key. You might have heard of DOTS in the context of TB. DOTS stands for Directly Observed Therapy, short course. It's a strategy where a healthcare worker watches the patient take their TB medication every single time. While TB usually affects the lungs, it can spread to other parts of the body, like the lymph nodes, bones, and even the brain. This is known as extrapulmonary TB. One symptom of extrapulmonary TB is swollen lymph nodes. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay healthy and informed. And remember, if you have any concerns about tuberculosis, don't hesitate to reach out to a healthcare professional. Early detection and treatment are key.